Hello guys, and welcome to my YouTube channel. In this video I'll be talking to you about heart attack, the causes, the symptoms, when to see the doctor, the complications and preventive measures you can take to tackle heart attack. A heart attack occurs when the flow of blood to the heart is blocked. The blockage is often a buildup of fat, cholesterol, and other substances which form a plaque in the arteries that feed the heart, the coronary arteries. Sometimes a plaque can rupture and form a clot that blocks blood flow. The interrupted blood flow can damage or destroy part of the heart muscle. A heart attack, also called a myocardial infarction, can be fatal, but treatment has improved dramatically over the years. It is crucial to call 911 or emergency medical help if you think you might be having a heart attack. Now let's talk about the symptoms that are common to heart attack. We have shortness of breath, cold sweat, fatigue, lightheadedness or sudden dizziness, nausea, indigestion, heartburn, or abdominal pain. Now, heart attack symptoms may vary. Not all people who have heart attacks have the same symptoms or have the same severity of symptoms. Some people have mild pain, others have more severe pain. Some people have no symptoms. For others, the first sign might be sudden cardiac arrest. However, the more signs and symptoms you have, the greater the chance you are having a heart attack. Some heart attacks strike suddenly, but many people have warning signs and symptoms hours, days, or weeks in advance. The earliest warning might be recurrent chest pain or pressure that's triggered by activity and relieved by rest. Now, when do you see a doctor? Act immediately. Some people wait so long because they don't recognize the important signs and symptoms. Take these steps. Call for emergency medical help. If you suspect you're having a heart attack, don't hesitate. If you don't have access to emergency medical services, have someone drive you to the nearest hospital because your condition can worsen, so driving yourself puts you and others at risk. Another step you should take is to take nitroglycerin if prescribed to you by a doctor, or take aspirin if recommended. Aspirin can interact with other medications. However, don't take aspirin unless the doctor or emergency medical personnel recommends it for you. Now, what do you do if you see someone who might be having a heart attack? If you see someone who's unconscious or you believe is having a heart attack, first call for emergency medical help, then check if the person is breathing and has a pulse. If the person isn't breathing or you don't find a pulse, only then should you begin CPR. Push hard and fast on the person's chest in a fairly rapid rhythm, about 100 to 120 compressions a minute. If you haven't been trained in CPR, doctors recommend performing only chest compressions. If you have been trained in CPR, you can go on to opening the airway and rescue breathing. Now, let's talk about the causes of a heart attack. A heart attack occurs when one or more of your coronary arteries becomes blocked. Over time, a buildup of fatty deposits, including cholesterol, form substances called plaques, which can narrow the arteries. Now, during a heart attack, a plaque can rupture and spill cholesterol and other substances into the bloodstream. The blood clot forms at the site of the rupture. If the clot is large, it can block blood flow through the coronary artery, starving the heart of oxygen and nutrients. You might have a complete or partial blockage of the coronary artery. Diagnosis and treatment might be different depending on which type you've had. Another cause of a heart attack is a spasm of a coronary artery that shuts down blood flow to parts of the heart muscle. Using tobacco and illicit drugs such as cocaine can cause a life-threatening spasm. Infection with COVID-19 may damage your heart in ways that result in a heart attack. Now, what are the risk factors? Certain risk factors contribute to the unwanted buildup of fatty deposits that narrows arteries throughout your body. Now, the risk factors may include age. Men age 45 or older, women age 55 or older are more likely to have heart attack than younger men and women. Another risk factor is tobacco, and it includes smoking and long-term exposure to secondhand smoke. Other factors are high blood pressure, high blood cholesterol, obesity, diabetes, metabolic syndrome, family history of heart attacks, lack of physical activity, stress, illicit drug use, a history of preeclampsia, and autoimmune condition. Now, what are the complications that comes with heart attack? Complications are often related to the damage done to your heart during a heart attack, which can lead to abnormal heart rhythms, heart failure, and sudden cardiac arrest. Now, how do we prevent heart attack? It's never too late to take steps to prevent a heart attack. Even if you've already had one, here are ways to prevent the heart attack. Number one, through medications. Taking medications can reduce the risk of a subsequent heart attack and help your damaged heart function better. Continue to take what your doctor prescribes and ask your doctor how often you need to be monitored. Another way to prevent heart attack is lifestyle factors. You know the drill. Maintain a healthy weight with a heart-healthy diet. Don't smoke. Exercise regularly. Manage stress and control conditions that can lead to a heart attack, such as high blood pressure, high cholesterol, and diabetes. So there we have it. Those are the ways to prevent heart attack. Thank you for watching this video. Please don't forget to like, subscribe, and comment in the comment section below. Thank you very much. Have a nice day.